Okay, so let us start now congestive heart failure. So congestive heart failure, what is the definition? So heart is unable to pump blood sufficiently to meet the metabolic demands of the heart. So there are various these reasons why heart is unable to pump blood. So what are the causes of heart failure? So there is a mnemonic that is known as HIT-FAR. Okay. So first one is like hypertension. So when long-standing persistent hypertension occurs, that leads to hyper left ventricular hypertrophy. Okay, so because of left ventricular hypertrophy, the pressure is created in the left ventricular end. Okay, so that leads to pulmonary. This is pulmonary vein. So pulmonary vein also hyper like pressure increases. So hence pooling of blood occurs in the lungs. So pooling of blood leads to pulmonary edema, and that leads to breathing difficulty. So this is one of the reasons. The next one is like anemia. So anemia here, oxygen and hemoglobin binding capacity is decreased. So anemia also leads to congestive heart failure. Next one is ischemia. So in cases of myocardial infarction. Next one is like thyrotoxicosis. What is thyrotoxicosis? Hyperthyroidism condition. So persistent hyperthyroidism state is known as thyrotoxicosis. Next one is like forgotten medication. So when patient is if he was past, he had some myocardial infarction or any heart diseases, he used to take medication. So because of forgotten medications also, congestive heart failure might occur due to the decreased pumping efficiency of the heart. Next one is arrhythmia. It can be anything. It can be bradyarrhythmia, tachyarrhythmia, then ventricular arrhythmia. So whatever arrhythmias can also lead to heart failure. Next one is renal failure. So in renal failure, the very important thing is like a glomerular filtration rate decreases that leads to RAS activation, hence renin increases. So ultimately hypertension. So when blood pressure increases, that leads to glomerular filtration rate also increases. So ultimately this renal failure is also a very important cause for congestive heart failure. Next one is like pathophysiology. So what is pathophysiology? Generally in heart failure, myocardial function decreases. So that leads to cardiac output also decreases. Hence, in our body, other compensating mechanism gets activated. That is sympathetic nervous system activated, renin, angiotensin, aldosterone system activated, and antidiuretic hormone also released. So that leads to these are the compensatory mechanism for congestive heart failure. So then preload and afterload also increases. Hence, myocardial hypertrophy and remodeling occurs. So pump failure worsens. Okay, so that leads to venous congestion and tissue hypoperfusion occurs. So what is tissue hypoperfusion? So what is venous congestion? So this is heart. Okay, so this is heart. So what is venous? This is SVC and IVC limited. So when suppose this is right ventricular failure, okay. So when right ventricular failure occurs, so the pooling of blood. So here the pressure also increases. In the SVC and IVC pressure increases. So what is happening here? Hepatosplenomegaly occurs. Hepatosplenomegaly occurs, and here ascites also occurs. So ascites in the abdomen occurs, and this is hepatomegaly occurs. Okay, so this is venous congestion. Tissue hypoperfusion because of inefficient pumping capacity of the heart. So heart is unable to pump blood to the periphery. So peripheries tissues are not getting enough amount of oxygenated blood. So hence cold clampy peripheries occur. So cold clampy periphery. Okay, so what is the symptoms? Okay, so this is palpitation. So patient tells that I feel, so I get palpitations. So these are the basic chief complaint of the patient. So diaphoresis. Diaphoresis is nothing but excessive sweat. So sweat is increasing. Okay, so excessive sweat production. Then shortness of breath is there. That is known as orthopnea and PND. This cases occurs in left ventricular failure. So in left ventricular failure, mainly lungs are affected. So hence orthopnea and PND occur. The nocturnal cough occurs. The nocturia also occurs on examination. This is very very important. So we have to differentiate whether it is a left ventricular failure or whether it is a right ventricular failure. So here this is left atrium and this is left ventricle. Okay. So what happens in left atrium? So when left ventricle fails. So when left ventricle fails, what happens? Left ventricle hypertrophy occurs. When left ventricle hypertrophy occurs, here pressure increases. So pressure increases. So hence blood from left atria becomes very difficult to enter into the left ventricle. So the blood stays in the pulmonary vein. So hence also in the lungs that leads to pleural effusion. So so the amount of fluid from the pulmonary capillaries, pulmonary venules, and from the pulmonary blood vessels, the plasma, the fluid content, it escapes from the vessels into the intraalveolar space and alveoli. So that leads to pleural effusion. So hence bilateral crackles occur. Then oliguria occur. Because of oliguria, why it is oliguria? Because the fluid collects in the lungs. So hence oliguria occur. And systolic blood pressure also decreases. Maximum heart rate, that is tachycardia. So left ventricular failure. So the main characteristic feature is heart rate is maximum. Heart rate is maximum. So how to find out maximum heart rate of a person? So we have a formula for it. 220 minus age. If suppose patient is 60 years old, so then we have to do 220 minus 60. So what is the answer? So we'll be getting nearly 160. Okay, so it is like that. So we have to calculate maximum heart rate. Next one is like right ventricular failure. So in right ventricular failure also we are having here. So this is major cause of most common cause of right ventricular right heart failure is left heart failure. So when left heart failure occurs, this is the previous new preview question, where what is the most common cause for right heart failure and what are the reasons given below is correct. That is regarding to the right ventricular failure. So the answer was left ventricular failure. So most commonly if patient had left ventricular failure, so that when time passes on, that left ventricular failure is also leads to uh, right heart failure. Okay, so the next one is like here the symptoms are like JVP is raised. So the Kussmaul sign. So what is Kussmaul sign? So when patient, if you ask the patient to inspire, okay, so on inspiration the JVP is elevated, so that is known as Kussmaul sign. Next one is like tender hepatomegaly. So when we do abdominal examinations, hepatomegaly, so when we keep our fingers while examining the patient, tender hepatomegaly occurs. Then ascites. Ascites is nothing but collection of fluid in the peritoneum. Then bilateral ankle pitting edema. So in both legs we can see pitting pedal edema will be there. So then next important information is like beta blockers. So beta blockers should not be given in acute congestive heart failure because since it reduces the heart rate, which is a compensatory mechanism, hence it worsens congestive heart failure. So beta blockers should not be given in acute congestive heart failure, but beta blockers can be given chronic congestive heart failure. So in acute congestive heart failure, we have seen that tachycardia is one of the main compensatory mechanism for maintaining the myocardial oxygen demand. So and also for the peripheries also blood supply is due to tachycardia. So because of the compensatory mechanism. So if beta blockers are given, then the acute compensation mechanism will be it will be affected. Next one is like treatment. Okay, so treatment we will be seeing about acute congestive heart failure, and we can see that in acute congestive heart failure there are two mechanisms are there. First one is like acute pulmonary edema and cardiogenic shock. So in acute pulmonary edema we can give we can have a mnemonic. Okay, so it's a mnemonic. So LMNOP. So that is L is for Lasix, that is furosemide and torsemide can be given. M is for morphine, that reduces the pulmonary edema. So morphine is such an important drug which reduces the pulmonary edema in acute congestive heart failure. Next one is like nitrates, blood vasodilators. Okay, oxygen. So oxygen should be given via non-invasive ventilation method. Next one is like positioning. So we have to position the head. So head should be placed higher than the feet. That reduces the venous return to the heart. Next one is cardiogenic shock. So in cardiogenic shock, we have to give two conditions can be there, and ionotropes can be given. That is dobutamine, beta-1 agonist, milrinone, that is ionodilator. Then mechanical circulatory support, that is intra-aortic balloon. These are the cardiogenic shock treatments. Okay, then we are having chronic congestive heart failure. So we have already seen that beta blockers should not be administered in cases of acute congestive heart failure, but chronic congestive heart failure, we have another two conditions, that is heart failure with reduced ejection fraction and heart failure with preserved ejection fraction. Okay, so heart failure with reduced ejection fraction. Okay, ejection fractions here reduced. Okay, So in this conditions, we have to give ACE inhibitors or ARB. This is the first line drugs. Okay, so heart failure, there is reduced ejection fraction. The first line drug is ACE inhibitors or ARB. Then we can also add beta blocker. Then supportive treatments such as spironolactone and angiotensin receptor neprilysin inhibitor. This is also very important drug. And in some patients, we cannot give ACE inhibitors or ARB. So when ACE inhibitors or ARB is contraindicated for such patients, we can give angiotensin receptor neprilysin inhibitor. Next one is like heart failure with preserved ejection fraction. So heart failure preserved ejection fraction. Here the first line of drug is this ARNI. So ARNI is nothing but angiotensin receptor neprilysin inhibitor. So here preserved ejection fraction. So hence we have to give ARNI is the choice of drug. Then supported treatment such as spironolactone, then SGLT2 inhibitor, then renin-angiotensin aldosterone directed therapy can be given. So hence now we have completed the congestive heart failure.